Welcome to the Educator Role of the Preceptorship course. The goal of this module is to introduce the participant to the educational process for assessment, planning, and implementation of learning experiences. At the completion of this area of content, the participant will be able to describe the learning process and explore various learning styles and stages of learning. Apply adult learning principles in teaching psychomotor skills. Formulate a learning plan using a variety of educational experiences. Establish performance goals, evaluation criteria including timelines. The educator is a person who provides instruction or education to the learner. Learning is the lifelong, dynamic process by which individuals acquire new knowledge or skill and alter their thoughts, feeling, and behavior. The learning process includes the higher mental process, transfer of learning, categories of learning. In the higher mental process, the following are included. Factors influence learning process. Memory related to learning. The following are the factors that influence the learning process. Environment such as mental stress, noise, busyness. Culture including generational, ethnic, gender. Intellectual ability because some people need more time to absorb and comprehend the content. Primary language, ESL usually think in their primary language. Need to translate and verify understanding by restating concepts. Takes more time, don't give several directions, until person has assimilated the first one. In philosophy of education, which includes liberal example, the liberal arts, general, not focused on one subject. Progressive thought builds on previous experiences. Behaviorist, describing the cause and effect or structured. Humanistic, whole person, inner drive, creativity. Radical, teaching to a cause or value. For the memory related to learning, the following are included. 1. Learning through association, example. Learn for the moment or test, remember association, not the concept. 2. Learning through contextualize, which is a higher level of learning. You learn by actual experience, by thinking, feeling, and doing. This will result to better retention. Second type of the learning process is the transfer of learning, which includes the factors influence transfer of learning. Motivating factor or enhancers. Barriers. Factor influence transfer of learning includes program participants, considering the following. Are they all starting at the same knowledge or skill level? Homogeneous. Heterogeneous group tend to teach in the middle level. Another factor that influence transfer of learning are the program design and delivery, such as lecture, demo, online, video. Include in many learning activities as possible. Time allotted according to design or shortened. Next, program content, considering how easy or difficult, and clarity of materials. Additional factors that influence transfer of learning are the changes required to apply learning, such as resistance to change, activity. Next, organizational needs, considering how important is this learning to the person or the job. Lastly, the community or societal forces with the expectations of student from community or family, and motivating factors or barriers. In the learning process under the transfer of learning, the following should also be considered. The motivating factors, or enhancers, and the barriers as well. The following are the stages of information process. Stage 1. Attention. Consider the impact of attention that governs information flow within other cognitive domains. Attentional processes facilitate, enhance, or inhibit other cognitive processes, and attention leads to orientation toward particular stimuli or responses, and away from others. Stage 2. Processing. Information is processed in steps or stages. There are limits on how much information can be processed at each stage. The human information processing system is interactive. Stage 3. Memory storage. The memory is the recall of things in the past, considering the following. Encoding or learning, the part on how information is entered into the memory system. The storage describes the part how information is kept or represented in memory, and the retrieval is how information is accessed or gotten out of memory when needed. There are 3-stage model of memory. First is the sensory storage. Sensory stores, or buffers less than a second to seconds. Second is the short-term memory. Conscious awareness of recently perceived events, seconds to minutes, and up to 30 seconds. Then the long-term memory, events that have left consciousness but can be retrieved from minutes to hours to decades. Stage 4. Action. The performance components are the actions taken in the completion of a decision-making or problem-solving task. The action, or performance components go beyond meta components in that they perform the function also of weighing the merit and/or consequences of actions in comparison to other options rather than simply identifying options. The social learning theory contends that much of learning occurs by observation, watching other people, and seeing what happens to them, such as providing examples or role models for how to think, feel, and act. Nursing educator, a more experienced nurse who demonstrates desirable professional attitudes and behavior, sometimes is used as a mentor for a less experienced nurse. The psychodynamic learning theory emphasize the importance of conscious and unconscious forces in guiding behavior, personality conflicts, and the enduring impact of childhood experiences. Example, nursing burnout is rooted in an overly idealized concept of the nursing role and unrealistic expectations for the self in performing the role. Some staff member and patients feel an inordinate need to control the self, other people in certain social situations. This behavior may have been rooted in their inability to resolve the crisis between trust versus mistrust at earliest stage of life. It is essential in working with these individuals to build a trusting relationship and to encourage them gradually to relinquish some control. One problem with this approach is that much of the analysis is speculative and subjective. Individual nurses' biases, emotional conflict and needs may distort their evaluation of other person and situations. Second, psychodynamic theory may be used inappropriately. It is not the job of the nurse to probe into the private lives and feeling of patients to uncover deep, unconscious conflicts. Third danger is that health professionals may use the many psychodynamic principles as a way of explaining away rather than dealing with people as individuals who need emotional care. The humanistic learning theory. This explains the Maslow hierarchy of need. The assumption that each individual is unique and that all individuals have a desire to grow in a positive way. Example, patients who are hungry, tired, and in pain will be motivated to get these biological needs before being interested in learning about their medications, rules for self-care, and health education. Comparison of learning theories. Each theory makes an original contribution to understanding the learning process, and can be used singly and in combination to help practitioners acquire new information, and alter existing thoughts, feeling, and behavior. The following are the learning styles: concrete experience, reflective observation, abstract conceptualization, active experimentation. The concrete experience explains, why is this important to me? Why feelings are important. The abstract conceptualization, focus about the logic and ideas. Systematic planning. Thirst for knowledge, and feelings less important. The reflective observation, focus on planning, and needs time to be done. The active experimentation, focus on practical, and sought to answer the question, does this work? The following are the additional learning styles: logical, mathematical, verbal or linguistic, intrapersonal, interpersonal, visual or spatial, body kinesthetic, and musical or rhythmic. The principle of adult learning: 10% of what is read, 20% of what is heard, 30% of what is seen, 50% of what is heard and seen, 80% of what is heard, seen, and done. The psychomotor skills are effective methods in teaching. Best job training method, and should consider the following: be prepared, motivate, create safe learning environment, develop a trusting relationship with perceptee. Teaching psychomotor skills consist of 4 steps. Step 1. Prepare. Promote learner motivation. Do a training plan, focusing on who, what, when, where, and how. Assess readiness. Do a job break. Motivate learner to proper learning position and location. Step 2. Present. Promotes learner understanding. Demonstration. Return demonstration. Step 3. Tryout. Provide learner participation. Behavior modeling. Reinforce what done correctly. Step 4. Follow up. Allows learner to apply. Encourage questions, feedback, and evaluate. Determining learning needs. Discover current level of performance. Identify what needs to be learned. Prioritize learning needs with preceptor by identifying high risk or high frequency, and what are mandated. Remember that learning needs are agreed upon by both preceptor and perceptee. Check the perceptee's levels of competency. Assess if you will categorize them as novice, advanced beginner, competent, proficient, or expert. In creating a learning plan, as a preceptor you have to consider the questions: who, what, when, where, how, and why. Goal setting, using SMART model. A specific goal has a much greater chance of being accomplished than a general goal. To set a specific goal you must answer the 6 W questions. Who is involved? What do I want to accomplish? Where? Identify a location. When? Establish a time frame. Which? Identify requirements and constraints. Why? Specific reasons, purpose or benefits of accomplishing the goal. Measurable. Establish concrete criteria for measuring progress toward the attainment of each goal you set. To determine if your goal is measurable, ask questions such as: how much? How many? How will I know when it is accomplished? Remember, if you cannot measure it, you can't manage it. When you measure your progress, you stay on track, reach your target dates, and experience the exhilaration of achievement that spurs you on to continued effort required to reach your goal. Attainable. When you identify goals that are most important to you, You begin to figure out ways you can make them come true. You develop the attitudes, abilities, skills, and financial capacity to reach them. You begin seeing previously overlooked opportunities to bring yourself closer to the achievement of your goals. Remember, a goal needs to stretch you slightly so you feel you can do it, and it will need a real commitment from you. You can attain most any goal you set when you plan your steps wisely and establish a time frame that allows you to carry out those steps. Goals that may have seemed far away and out of reach eventually move closer and become attainable, not because your goals shrink, but because you grow and expand to match them. When you list your goals, you build your self-image. You see yourself as worthy of these goals, and develop the traits and personality that allow you to possess them. Realistic. To be realistic, a goal must represent an objective toward which you are both willing and able to work. A goal can be both high and realistic. You are the only one who can decide just how high your goal should be. But be sure that every goal represents substantial progress. Remember, set the bar high enough for satisfying achievement. A high goal is frequently easier to reach than a low one because a low goal exerts low motivational force. Some of the hardest jobs you ever accomplished actually seem easy simply because they were labor of love. Timely. A goal should be grounded within a time frame. With no time frame tied to it, there's no sense of urgency. Your goal is probably realistic if you truly believe that it can be accomplished. Additional ways to know if your goal is realistic is to determine if you have accomplished anything similar in the past, or ask yourself what conditions would have to exist to accomplish this goal. What help ensure that learning becomes relatively permanent? First, organize the learning experience, making it meaningful and pacing the presentation in keeping with the learner's ability to process information enhance the likelihood of learning. Second, learning is strength by practicing mentally and physically new knowledge and skill under varied conditions. Third, reinforcement. Fourth, whether learning transfers beyond the initial educational setting. Although reinforcement may or may not be necessary, some theorists have argued that reinforcement may be helpful because it serves as signal to the individual that learning has occurred. Learning cannot be assumed to be relatively lasting or permanent. It must be assumed to be assessed and evaluated soon after learning experience as well as by follow-up measurements at later time. To be an effective preceptor, you have to do the role of educator in the nursing units. The educator role are the following: assessing problems or deficits, providing appropriate information and presenting it in unique ways, identifying progress being made, giving feedback and follow-up, reinforcing learning and acquisition of knowledge, the performance of a skill, or change in attitude, evaluating learners' abilities, giving support, encouragement and direction during the process of learning, identify optimal approaches, and provide assistance in choosing learning activities. For more detailed information, please check the following references used for this lecture. Thank you for watching. We look forward to see you as the future preceptors in the nursing units.